my name is Sarah. I'm going to be your nurse for today. How are you? Good. Going to wash my hands, close the door for privacy, and all right, can you state your name and date of birth for me? Okay, you said your name was Ivan EMOTO, date of birth 12/1, Ivan EMOTO 12/1, EMOTO 12/1. Okay, do you have any allergies, Mr. EMOTO? Yes, you do. Okay, so you said you're allergic to penicillin, cephalosporins, and midazolam. Allergies, cephalosporin, penicillin, midazolam, and the patient is wearing a allergy bracelet. I'm going to verify the MR number with my chart here. 819-6375, 819-6375. Okay. All right, Mr. EMOTO, today we're going to be doing a head-to-toe assessment on you, and we're going to be administering some of your medications, and I'm also going to be doing some teaching with you. Okay, so I'm going to get started. Take some vitals. Blood pressure, 158/98, heart rate 102. Take your temperature, 98.7, and your oxygen is 87% on room air. We do have an order for you to have oxygen. We want to get that O2 up to at least 92%. So we put on the oxygen. We're going to titrate that up until your O2 sat says 92%. It'll help you breathe a little bit easier too. Okay, I'm going to take your respirations, 30 seconds. Okay, respirations are 32. I'm going to raise the head of the bed. That's going to help you breathe a little bit easier. Okay. Okay, are you in any pain today, Mr. EMOTO? You said yes? Okay. Can you rate that pain on a scale from 1 to 10? You said 2? Okay. And then can you describe that pain for me? Said it's sharp and it comes and goes. Okay. And where is that pain located? Your knees? Okay. Is there anything that makes it better? You said the fact that it goes away quickly? Okay. And what makes it worse? You turning your knees? Okay. And then, does that pain radiate anywhere? No? Okay. Okay. Mr. EMOTO, do you know where you are today? Do you know why you're here? And can you tell me the date? Okay, so patient is alert and oriented ×4. I'm going to shine this light in your eyes. Okay, and follow the pen. Okay, so patient's pupils are equal, round, and reactive to light, and they're also able to accommodate. I'm going to check oral mucosa, say ah. Oral mucosa is pink, moist, and intact. I'm going to check for skin tenting. Okay, and the skin is non-tenting. Mr. EMOTO, have you had a cough? You said yes? Okay. Is it productive or non-productive? It's productive? Okay. And what was the color of that? You said white? Okay. And the consistency? Thin? Okay. And if you were to cough in a little small medicine cup, about how many milliliters do you think you could cough up? 15 milliliters? Okay. All right, well, I'm gonna take a listen to your lungs. I'm gonna listen to 8 places on the front and then 10 on the back. Okay. All right, so I hear crackles in the lungs. Respirations are shallow and labored, and I would also listen to 10 places on the back as well and find the same findings. Okay. Gonna listen to your heart. I'm gonna start with the right second intercostal space to the right, which is the aortic. S1, S2 heart. Second intercostal space to the left is the pulmonic. S1, S2 heart. Third intercostal space to the left is Erb's point. S1, S2. Fourth intercostal space to the left is the tricuspid. S1, S2. Fifth intercostal space. Fifth intercostal space, mid-clavicular line is mitral. S1, S2. I'm going to listen for a full minute for the apical pulse. Okay. Right, the apical pulse is a 102 beats per minute and it is irregular. Sorry, Mr. Emoto's kitty won't leave us alone. Sorry, kitty. Okay. Next, I'm going to listen for your pulses, or feel for your pulses. Brachial pulse. +2, irregular. Radial pulse. +2, irregular. Okay, I'm gonna feel for capillary refill on both sides as well. And it is less than 3 seconds. Can you squeeze, push down, and pull up? Okay, great. They're +5, equal bilaterally. Alrighty. I'm gonna assess your IV site. Okay, the dressing is clean, dry, and intact. It is initialed and dated for today. There's no redness, swelling, or infiltration, and also I would flush it for P&C at this point. Okay. All right, Mr. Emoto, when was your last bowel movement? You said last night? Okay. Can you tell me the color? Brown. And the consistency? Soft? Okay. Was there any unusual odor? None? Okay. And then about how much? Small? Okay. Alrighty. I'm gonna inspect the abdomen. Okay, and the abdomen is flat. I'm gonna take a listen. Starting with the right lower quadrant. Vowel sounds are active, right upper quadrant. Vowel sounds are active, left upper quadrant. Vowel sounds are active, left lower quadrant. Vowel sounds are active. Okay, good. All right, I'm gonna palpate your abdomen, and can you tell me if you feel any pain or tenderness? Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, no pain or tenderness noted. Okay. When was the last time that you urinated? Okay. Don't remember? Okay. About how much was that? Less than 100 milliliters? Okay. In the color? You said dark yellow? Okay. And the clarity, was it clear? Was it cloudy? It was cloudy? Okay. And then, did it have any unusual odor? It had a strong smell? Okay. Did you have any pain, urgency, or frequency? Okay. No pain, no urgency, and then a decrease in frequency? Okay. I'm so sorry that you're ruining my videos. I love you. Goodness. Okay, where were we? Okay, so now I'm going to inspect the genitalia. So I pull up your shirt, and there are no lesions, edema, abnormalities, discharge, or any sores noted. Put that down. Okay. I'm going to assess any edema on the legs, on both sides. 2 edema. I don't know if there's any edema. Let me look really fast. Okay. It doesn't say. Okay, well, we're gonna say that he has +3 pitting edema in both sides of his legs. Okay. All right, now I'm gonna assess the skin temperature. Warm and dry. Skin color is appropriate to ethnicity. I don't see any breakdown or lesions or any other abnormalities of the skin. Wash my hands. And put on some gloves. Okay, I'm gonna palpate the pulses. Posterior tibialis is +1, and dorsalis pedis on both sides is a +1. And check for capillary refill, less than 3 seconds. Can you push down and pull up? Okay, So strength equal bilaterally is +5. Take my gloves off, wash my hands. Okay, and I don't think that I inspected the thorax for auscultating, so I'm gonna do that. Check for symmetry. Okay, and chest expansion seems symmetrical. Okay, Mr. EMOTO, I am all done with my assessment. I'm gonna go ahead and call the doctor, okay? So I'm gonna put your bed down and your rails up for your safety. I'll be right over here. Okay. Okay, ring, ring. Hi, my name is Sarah. I am the nurse taking care of Mr. Ivan EMOTO here in room 148. He was admitted with shortness of breath coming in, and he had not been taking his water pill for the last 5 days. He came in with swollen ankles. He seems to not remember what pill that he had taken. He said that he took one of his heart pills. He's on several medications for chronic heart failure. He was first diagnosed at age 60. He denies any injury or any trauma. He did have a surgical history of a right inguinal hernia repair at the age of 52. Just a little background. And then going over my assessment here, I did auscultate the lungs, and I did find that he did have some crackles in his lungs. I had to raise the head of the bed. His respirations were 32. Seemed like he was having a hard time breathing. Per your orders, I did put on oxygen and kind of titrated up so his O2 could increase to 92% from 87% on room air. He does have a productive cough. The mucus or the sputum is white. It's thin, and he said that he could cough up 15 milliliters in a little cup. Going forward, his urine, dark yellow, less than 100 milliliters, strong smell and cloudy too. So he said that he did have a decrease in frequency as well. I did see an order for a Foley. Also going forward, he did have a little bit of a pitting edema in the lower extremities. Dorsalis pedis and posterior tibialis pulse were +1, probably due to the edema that I did assess. Going over some of his labs, his hemoglobin, his hematocrit, and his white blood cells were a little high. I'm thinking maybe the cause of vitamin deficiency or anemia. The white blood cells might be a little elevated. I'm thinking maybe because due to pneumonia or some other respiratory infection. His BUN was a little low, probably due to a little bit of dehydration that's going on. His CO2 and really all of his ABGs show respiratory alkalosis being compensated. So I recommend maybe getting a chest x-ray to kind of rule out any pneumonia. Also urinalysis to kind of see if there is any other infections going on, since his urine was dark and cloudy. So I do recommend a chest x-ray just to rule out any other respiratory infections, and then a urinalysis as well. He did have some pain in his knees. I believe that there is a order for acetaminophen, so I will read back your order. Okay, so chest x-ray and urinalysis. Okay, thank you. Alrighty. All right, Mr. Emoto, I just got off the phone with the doctor. I am a little concerned with the productive cough and the crackles in your lungs. It could just be due to your heart failure complications, but I just kind of want to get a chest x-ray to rule out any other infection. And then also you did state that your urine was a little bit cloudy and a dark amber color, so we're gonna get a urinalysis done to just rule out any other infections, okay? So I am going to run to the med room. I'm gonna grab some medications for you and I will be right back. So bed down, rails up. Here's your call bell. If you need anything, just press it. Did you need anything else? No? Okay. And then I'm going to wash my hands and open the drawer for privacy. Well, just open door. Okay, so we are going to walk into the bedroom. Oh. Okay. Let me pull up the patient's chart. Okay, so I'm gonna wash my hands. Excuse me. And I'm going to begin for Ivan Emoto. Okay, I have patient Ivan Emoto, MR number 8196375. He is allergic to penicillin, cephalosporin, and midazolam. Date of birth is 12/1. I am going to be giving a multivitamin, 1 tablet by mouth daily, due now. And in my hand, I have multivitamin, 1 of these. Expiration 3/21. Oops. Okay, I have patient Ivan Emoto, MR number 8196375. He is allergic to penicillin, cephalosporin, midazolam. Date of birth 12/1. I am going to be administering acetaminophen, 650 milligrams PO, every 4 hours for mild pain, due now. And in my hand, I have acetaminophen, 650 milligram tablets. Expiration 9/23. Okay. Oops. All right, I have patient name Ivan EMOTO, MR number 8196375. He is allergic to penicillin, cephalosporin, midazolam. Date of birth is 12/1. I'm going to be administering a multivitamin, 1 tablet by mouth daily, due now. And in my hand, I have a multivitamin, one daily. Expiration is 3/21. I have patient name Ivan EMOTO, MR number 8196375. He is allergic to penicillin, cephalosporin, and midazolam. Date of birth is 12/1. I'm going to be administering acetaminophen, 650 milligrams PO every 4 hours for mild pain, due now. And in my hand, I have acetaminophen, 650 milligram tablet. Expiration 9/23. Okay, awesome. All right. So, knock. Hi, my name is Sarah. I'm your nurse for today. I just have a couple medications that I want to give to you. I'm gonna close the door for privacy. I'm gonna wash my hands. Can you state your name and date of birth for me, please? You said Ivan EMOTO, 12/1. Ivan EMOTO, 12/1. Mr. EMOTO, do you have any allergies? Yes? Okay. Said penicillin, cephalosporin, and midazolam. Okay, perfect. And the patient is wearing an allergy bracelet band. All right, I'm gonna verify the MR number, 8196375, 8196375. Okay. All right, so what I was saying before, I just have a couple medications that I have for you. I have your multivitamin, and I also have some acetaminophen, which would help out with the pain that you're having in your knees. So I'm gonna do my third check. Let's just pretend we're still in the patient's room. Okay. Go back up here. Alrighty, I have patient name Ivan EMOTO, MR number 8196375. He is allergic to penicillin, cephalosporin, and midazolam. Date of birth is 12/1. I'm going to be administering a multivitamin, 1 tablet by mouth daily, due now. And in my hand, I have the multivitamin, 1 tablet. Okay. Alrighty, I have patient name Ivan EMOTO. MR number is 8196375. He's allergic to penicillin, cephalosporin, and midazolam. Date of birth is 12/1. I'm going to be administering acetaminophen, 650 milligrams PO every 4 hours for mild pain, due now. And in my hand, I have acetaminophen, 650 milligrams. Okay. All right, Mr. EMOTO, I have your multivitamin. That's going to be the orange colored one, and then the acetaminophen is going to be the white one. And that should help out a little bit with your knee pain. Here you go. Okay. All right, Mr. EMOTO, so we do have an order to put a Foley catheter in. Now, unfortunately, we don't have all of the supplies to do that now. So once I educate you a little bit about teaching, that will kind of help maintain the symptoms that you're having from your congestive heart failure. I'll come back and do that in a little bit, okay? But I did want to touch on some key points that I think it's really, really important to know, just kind of about how to help manage some of the symptoms that you are experiencing, kind of like the shortness of breath and a little bit of edema on your legs, some things like that. So I did want to start off by, just some relaxation techniques that will kind of help calm your mind and kind of relax you when you are feeling overwhelmed and in pain and stuff like that. So some of the non-pharmacological methods that I did want to go over is some ways to help reduce some of that pain and that anxiety. So it really helps if sometimes you just close your eyes and you picture you're on a beach somewhere, and this really helps distract your mind when you are feeling anxious and in pain. And then another thing that I did want to talk to you about, or actually first, can you explain one of the ways that I went over with you about how to kind of reduce some of that pain and that anxiety that you might be feeling? Guided imagery? Yes. Okay. And then the second thing that I wanted to talk to you about is in relation to your heart. So with your condition here, congestive heart failure, it causes a lot of fluid overload, which I can hear in your lungs. That's why you have some crackles and some extra fluid on the tissues and on your legs. So we do have you on a fluid restriction of 1,000 milliliters. So it's really, really, really important to kind of monitoring what you're drinking and what you're eating throughout the day. Because we don't want you to be taking in more fluids than what you are supposed to, and then your body retains that fluid, and it can cause more edema and more pulmonary congestion, like how you're feeling in your lungs. It's also really important to take daily weights. So what's happening is with the cardiac, your congestive heart failure, sometimes it causes, just 1 minute. Sorry, pause, just 1 minute. Write some of this stuff down. Right, well, I lost my train of thought, but let's just keep going. So, sometimes when congestive heart failure kind of causes fluids to be retained in your muscles. And so it's really important to monitor your weights, because you have to know when to report to us and to your healthcare provider when you do gain a certain amount of pounds in a week. So if you gain more than 3 pounds in a week, you need to give us a call. When you are taking your daily weights, it's important to wear the same type of clothing and do it first thing in the morning. So can you tell me what you should be wearing and kind of when you should be taking your daily weights? Same clothing and in the morning, yes. Okay, so for your lungs, you have been having shortness of breath and you feel like you can't catch your breath, and it's really important that when you do start feeling like you can't catch your breath, to elevate the head of the bed. So when you sit up and you're elevating the head of the bed, it improves the oxygenation and perfusion in your lungs. So it kind of helps out with your breathing. It makes it a little bit easier. And then also we do have here an incentive spirometer for you to use. The incentive spirometer is really important, especially when you do have that congestion in your lungs, and when just for when you're here in the hospital and you're laying down, you're not moving around as much. It's important to kind of expand that alveoli in your lungs and to keep your lungs perfusing and getting that right amount of oxygen that it needs. So the incentive spirometer will help out with that. So here's this incentive spirometer. I'm going to show you how to use it. So you take a deep breath, and then the next breath, the next inhale, you want to suck on the tubing. And then you want to get that device. Oh, my brain's fried. Okay. So you want the device, when you do suck in, it will go up. And the more you use the incentive spirometer, the better that your lungs will start receiving oxygen and perfusing. Okay, so in relation to your heart failure, it appears that your kidneys may be being affected by your heart failure. So when your heart doesn't perfuse the blood appropriately to all of your organs, and major organ that is receiving that blood are your kidneys. So when the heart is not perfusing the blood to the kidneys correctly, that starts to cause some problems. So it's important that you stay on a low sodium diet. This also will help you not retain so much fluid, because the more sodium that you do take in, the more fluid that will stay in your body. So if we decrease your sodium, it will help out with that as well, with the edema on your legs and the pulmonary congestion. So it's important to have a 2 to 4 gram diet per day. And you know, when you are cooking and when your caregiver is cooking for you, it's important to limit that salt. So instead of using salt substitutes, I have found that food tastes really yummy if you season it with some fresh herbs or spices, and then with some lemon juice, stuff like that. So can you tell me what to cook with instead of salt substitutes? Lemon and fresh herbs. Good. Okay. And then also, it's important when you're laying here in the hospital, you're not really getting that much exercise. We want to get that blood working and perfusing throughout your body, and we don't want your muscles to get all stiff and stuff like that. So it's important to get up and ambulate every once in a while. But when you are doing activities, it's also equally as important to take periods of rest so you don't tire yourself out and get too much out of breath. Also, along the same lines, as you're laying here, you are more prone to getting pressure ulcers, because your skin is just, they have specific pressure points, like right on your sacrum and like on your lower back, pushing against the bed. And when it's not getting that appropriate amount of blood perfused to that area, it can cause breakdown of the skin. So it's really important to kind of turn and move every couple of hours, say 2 hours. So can you explain to me, like when you're doing some activities and stuff, what's one of the most important things you have to remember so you don't overexert yourself? Take periods of rest, yes. And then also, while you're laying here in bed, what's one of the most important things to prevent skin breakdown? Turning and repositioning every couple hours, yes. And also, if you need help, or you need to get up out of bed or use the restroom, or just want to go for a walk, your call button is there for you to call us, and we're always there to help you. And also, when you do kind of retain some of that fluid on your legs, it's really important to kind of keep those legs elevated. It helps kind of get rid of some of the fluid off of your tissues as well. Okay. All right, Mr. Emoto, do you have any questions for me? Anything that you want to go over again? No? Okay. All right, and then, okay, so I think we are all done. I'm going to put the bed down, the rails up. We're going to, rails up. Here is your call bell. Did you need anything else from me? No? Okay. All right, so I'm gonna wash my hands. And I'm gonna open the door. Yeah, my brain.